Do your knees hurt when you walk, stand up, or climb stairs, and you feel scared that the pain will never go away as you grow older? Today I will show you simple exercises you can do at home to make your knees stronger and help reduce pain, even if you are over 50. Now let us talk honestly. Knee pain is very common, especially as we age. Many people wake up in the morning and feel stiffness in their knees. Some feel pain when they try to stand from a chair. Others avoid stairs because they are afraid their knee will hurt or give up. Slowly, they start moving less. But when we move less, our muscles become weak, and weak muscles make knee pain worse. This becomes a bad cycle. Pain makes us rest too much, and resting too much makes pain stronger. But here is the good news. Knee pain does not mean you must stop moving forever. In fact, the right kind of movement can help your knees feel better, stronger, and safer again. Your knee is like a door hinge. If the screws around the hinge are loose, the door shakes and makes noise. The screws are like your muscles. When muscles around your knee are strong, your knee feels stable. When they are weak, pain starts. Today, I will teach you simple exercises you can do at home. You do not need a gym. You do not need expensive machines. You only need a chair, a wall, and your body. These exercises are gentle and safe for most people, especially seniors. Always remember, if you have serious injury or very strong pain, talk to a doctor first. Let us begin. First, we will start with a chair exercise. Sit on a strong chair. Keep your feet flat on the floor. Your knees should point forward, not inward or outward. Now slowly stand up from the chair. Try not to use your hands if you can. When you stand fully, pause for 1 second, then slowly sit back down. Do not drop fast. Move slowly and with control. This exercise is very powerful. It trains your thigh muscles. These muscles protect your knee joint every time you stand, walk, or climb stairs. When these muscles are weak, the knee takes too much pressure and starts hurting. Try to do this 8 to 10 times. If it feels easy, you can do more. If it feels hard, that is okay. Even 5 times is good. The most important thing is to be consistent. Now we move to the second exercise. Sit on the chair again. Keep your back straight. Slowly lift one leg and straighten it in front of you. Hold for 3 seconds. Then slowly bring it down. Switch legs. Do this 10 times on each leg. While lifting your leg, tighten your thigh muscle. You should feel it working. This exercise strengthens the front thigh muscle, which supports your knee while walking and standing. If you feel pain, lift your leg only halfway. Never force your body. Now we go to the wall exercise. Stand with your back touching the wall. Walk your feet a little forward. Slowly bend your knees and slide down the wall. Go only as low as you feel comfortable. Hold for 5 seconds, then slowly slide back up. Start with 5 times and slowly increase to 10. Do not go too low. Halfway is enough. Your knees should not go in front of your toes. Keep your back on the wall and breathe normally. This exercise strengthens your thighs, hips, and knees together. These muscles work as a team to protect your knee joint. Strong team means less pain. Next, we will strengthen your calves. Stand behind a chair and hold it for balance. Slowly lift your heels and stand on your toes. Hold for 2 seconds. Then, slowly lower your heels back down. Do this 12 to 15 times. Strong calves help you walk better and keep balance. Good balance means fewer falls and less knee injury. If you feel confident, you can try without holding the chair, but safety is more important. Hold the chair if needed. Now we move to a simple step-back movement. Stand straight, step one leg back slowly. Bend your front knee slightly. Your back knee goes toward the floor but does not touch. Then return to standing. Switch legs. Do this 6 times on each leg. Move slowly. Hold a chair if needed. This exercise strengthens your hips and thighs. Strong hips help your knee stay in good position and prevent twisting. If this feels hard, you can just step back and come forward without bending too much. Even small movement helps. Next, we will lie down for a gentle exercise. Lie on your back on the floor or bed. Bend one knee. Keep the other leg straight. Slowly lift the straight leg up to the height of the bent knee. Hold for 3 seconds. Then slowly lower it. Do this 10 times on each leg. This exercise strengthens your thigh without putting pressure on your knee. It is very good for people who cannot stand for long. Now let us talk about why these exercises work. Your knee does not work alone. It depends on muscles in your thigh, hip, and lower leg. When these muscles are strong, they share your body weight. This takes pressure away from your knee joint. Think of carrying a heavy bag. If one person carries it alone, it hurts. But if many people help, it feels lighter. Your muscles help your knee carry your body weight. Many people think rest will fix knee pain, but too much rest makes muscles weak. Weak muscles mean more knee pain. So movement is like medicine, but it must be the right kind of movement. No jumping. No twisting. Only slow and controlled exercises. You should do these exercises 3 to 5 days a week. You can do them all in one session, or split them into morning and evening. Each session only takes 10 to 15 minutes. This small time can change your life. Here are some safety tips. Stop if pain is sharp or sudden. Mild muscle pain is okay, but joint pain is not. Breathe slowly. Drink water. Wear comfortable shoes. Never compare yourself to others. Your journey is your own. What results can you expect? In the first week, you may feel muscle soreness. This is normal. In the second week, standing will feel easier. In the third week, daily movements will hurt less. In the fourth week, you will feel stronger and more confident. Healing takes time. Be patient with your body. Now let us talk about lifestyle habits for strong knees. Try to keep a healthy weight. Extra weight puts pressure on your knees. Drink enough water. Your joints need water to stay healthy. Walk daily, even if only for 10 minutes. Avoid sitting too long. Stand up every 30 minutes. Eat healthy foods like vegetables, fruits, nuts, and protein. These foods help muscles recover and grow. Your mindset is also very important. You are not weak. You are not broken. Your body is asking for care. Age does not mean pain. Age means wisdom. Every small step you take today is protecting your future. If you stay consistent with these exercises, your knees will thank you. You will feel stronger. You will feel safer. You will walk without fear. You will stand without pain. You will enjoy your life more. Your body is amazing. When you give it movement, it gives you strength. Start today. Not tomorrow. Not next week. Today. Because you deserve a life with less pain and more freedom.